Hey YouTube, this is Dawn and you're following this journey. Today is May 2nd, 2013, and this is my 19-week post-op VSG update. I was determined to get this done on time this week and I almost forgot, so I was getting ready for bed and it was like, whoops, gotta do my video. So I'm a bit tired, but just bear with me. My starting weight was 318 pounds, and on the date of surgery I weighed 295.2 pounds. This week I weighed in at 233.8 pounds, which is 1.8 pounds up from last week, so I've had almost a 2-pound gain. Not really a shocker, been an interesting week. So today I have monthly visits with my primary care physician because I get B12 shots, and I did get a chance to talk to him today about me going to the ER last week. So he said he wants me to follow up with the surgeon's office, even though I called them and talked to the nurse practitioner there. He still wants me to go and physically be seen by somebody. I don't know if I'm going to necessarily do that because the consensus already, just from based on my test results, was that everything was fine and that there was a possibility that it may have been gas. Both the nurse practitioner and my doctors in my primary care physician's office and my primary care physician are thinking gallbladder, but you know, he did a bunch of blood work on me today, and we'll see if there's anything that comes back from that. Then I'll definitely make sure that I call the surgeon's office. But if not, I'll just wait it out and see what happens. NSV this week. Actually, today I was at my doctor's appointment, and he was taking my blood pressure, and I'm looking at the cuff, and I'm trying to see what size cuff he's using, because he always uses a cuff that is like a thigh cuff. It's like they always have to go out and get the big cuff. And so I'm looking to see which cuff it is that he's using. He finally says to me, "What are you doing? What are you looking at?" And I said, "I'm looking for this size." So I'm down to I don't know if it's an extra large or large. It just was not a thigh size pressure cup. So I was kind of hyped about that. That was a good thing, because the last time I was there 2 months ago, I did have to use that. Let's see. Sorry, just looking at my notes really quickly. So I kind of want to talk about what's going on. Well, let me talk about this first. I realized that I was sabotaging myself without even knowing it. It was really weird. I just kind of had this revelation. And how it came about is that I told you guys when I talked about my vision board that one of the things I wanted to do was I wanted to attempt to run. And I wanted to do the C to 5K, which is the couch to 5K. If you're not familiar with it, it's an 8 or 9 week program depending on what app you use or what website you go to. But it basically gets you from sitting your butt on the couch to being able to run a 5K, or 30 minutes, I think is the more correct term, consistently within 8 to 9 weeks. So for me, I do have issues with my knees. They're weight-based, and I wanted to give myself enough time. This was back in January when we did the vision board, to give myself enough time to actually get some weight off. And I've been seeing a lot of people doing running on Facebook, and it's like, I want to run, I want to run, I want to run. And the way that I was sabotaging myself is I would say, I want to run, but I don't know if my knees are ready yet. I wish I could run, but I don't think my knees can take it. And I realized that I've been saying this for a while now, and the concern about my knees is a very valid concern, but I can't continue to say that and not even try to run. And that's where I was sabotaging myself, that I was basically backing up the fact that I could not even attempt to run. So I came to this realization like Saturday night, Sunday morning, and when I got my butt up on Sunday morning, I went to the gym and I did the first day of C to 5K, and I killed it. I I was fine. You know what I mean? Like, I was sore afterwards, and I took a Tylenol, and it was good, but it felt good to know that I had recognized that I was sabotaging myself. Even though I didn't know I was doing it, it wasn't like on purpose, you know, and it wasn't something. So I think we have to be very careful about the things that we say, because, as you've heard, our words become our actions or our non-actions, and that was the case with me. So, you know, I still may run into problems with my knees, but at least I'm trying and putting forth the effort. And if all goes well, I'll be running my first 5K on July 20th. So I'm hoping that I can do that. So that's exciting. Also this week, I've been having a hard time emotionally. There are a lot of things going on in my life right now. And, you know, things happen, you know, but I think they're just a lot at once, and it just really has me wanting to eat. And part of that is that eating is how I dealt with things in the past. And, you know, weight loss surgery, the only thing weight loss surgery changed was the size of my stomach. It didn't change my thoughts. It didn't change my habits. It didn't change any of that. So now that I can't eat the way I used to eat and numb myself the way I used to numb myself, and, you know, I have all these feelings, and I'm just feeling so, like, exposed, and I'm feeling so raw, and just trying to deal with it. And Monday I had a really hard day, and I ate a lot, and it was weird because it started off like I wanted a cookie, and I fought about, you don't need a cookie, I want a cookie, don't, you know, back and forth and back and forth. And finally I went up to the cafeteria to get a cookie, and they didn't have any cookies. So next thing I know, I'm at the vending machine, and I buy this cinnamon bun, and it was huge, and I was really shocked because I was able to eat the whole thing, and just that quick. I had like 400 calories down, and that's kind of scary. So, you know, I think for me, like, I have this need, like, I want to be perfect. And I know I'm not, I'm far from it. But I want to be perfect in my journey, and I want to be perfect in all I do. And I just have to realize that I need to learn how to accept these feelings. I need to learn how to feel these feelings without reacting in the way that I did on Monday. So, the rest of the week's been pretty good so far. Today is Thursday, and you know, I'm moving a lot, and I'm doing that, and it's just been tough because, you know, feelings, woo, baby, that's the part of the journey they tell you about, but you don't know till you get there. So, you know, it'll pass, and, or you know what, it won't pass, but I will learn how to deal with them better, and so that's the goal. And I think that's pretty much what's our time looking like. Sorry. Okay. So, I guess that's just the goal. I've been making sure that I've been walking a lot. I really miss walking. I hadn't been walking when I started going to the gym more. I wasn't taking my lunch walk, so I've been doing that. And I guess that's really all I got. It was something else I wanted to tell you. Oh, my skin is so dry, and I had posted this on Facebook, and a lot of people are dealing with this, but I mean, to the point, my forehead, 3 hours after I'm out the house, you can start seeing it like flaking and peeling, and not sexy at all. So I was kind of excited. The reason I brought it up is because today was the first day that it did not peel and flake. So I've been doing a few things, and I got some great suggestions on Facebook that I'm going to try. But I've been drinking enough water. I'm not dehydrated. And I really, like, for the most part, use like natural, well, no, that's not true. I use oil because my skin is dry anyway. I use a combination of grapeseed oil, olive oil, and vitamin E oil. But I forgot I had this olive oil sugar scrub I made, which is basically just sugar, some cinnamon, and some olive oil, and I've been using that for like the last 2 days, and it seems to really have made a difference. And I also had this stuff I bought a while ago called I think it's Egyptian Secret. I don't know. It's some kind of like, it has beeswax in it, but I decided to put that on during the day today. That's usually something I would only use at night when I used it, when I got it. But like, I'm at the point I'm trying everything, so I figured it would help lock in the olive oil, and it did really good today. I didn't have any flaking, so I'm going to keep that regimen up, and hopefully whatever's going on just stops. So yeah, that's all I got. Interesting week, and up almost 2 pounds, and that's what happens when you're not diligent in your journey. You know, the weight creeps back on. And yeah, so next week hopefully we'll be reporting a loss because I've been working hard. So I'm going to bed because I'm tired. So have a good night. This is Dawn, and you're following This Is Journey. Bye.